Let's bring into the stream Dr. Jay Schnitzer. He is Vice President, Chief Medical Officer, and Chief Technology Officer at MITRE Corp. It's good to see you again. One of the things I'd like you to talk about, because we keep talking about the government role in the COVID-19 healthcare situation, but you're part of a private sector response to the COVID-19 pandemic. Tell us about this.
Well, we started just a little over a year ago now, last March, the COVID-19 Healthcare Coalition as a group from the private sector spontaneously, when private sector organizations came together and said, we really want to try to do something about COVID, remember, this was just before it was starting to break out in the US in large numbers, knowing that there was going to be an impending clinical burden on our healthcare delivery system, to try to do something to prepare the systems for that and better enable them to deal with it from the private sector viewpoint. We started off with a couple of dozen members and very quickly ended up with over 1,000 organizations, not people, but organizations, large and small, who are all volunteering time and resources, all pro bono. Nobody got paid anything to participate in this effort, and this is ongoing to this day.
Doctor, you're looking at the numbers, and the cases have been climbing here in the U.S. We've seen the warnings about another wave. How worried are you that this is the start of another wave here in the U.S.?
Well, I am concerned. I mean, if you look at the most recent numbers for daily new cases, you will see that they came down phenomenally well during the month of February. But more recently, there's been a bit of a plateau and now a slight uptick over the last few days, which is pretty concerning. We were seeing a nice downward trend, and the fact that it's going back up and driven at least in part by the variants, particularly the UK variant across the country, which is estimated to be 40 to 50% overall of the new cases, that is of concern. We're now in a race between the variants and vaccinations, and we've got to maintain our vigilance in terms of practicing good behaviors. That includes wearing masks, good hygiene, and social distancing until enough Americans are vaccinated to reduce this risk. If we don't, we're going to see this go up.
We got the positive news about Pfizer, though. Their vaccine seems to be quite effective against the South African variant. Everyone was worried about that. So with that kind of news, how do you debunk the perception that Pfizer and Moderna are the great vaccines and that AstraZeneca and maybe the one and done Johnson & Johnson, not so much?
There's really no difference in terms of their efficacy. I mean, the numbers, the differences are small, but what really matters are the data over time. And so far, we only have long-term data, 6-month data on Pfizer, which looks excellent. But what we really want to see is the data from the other vaccines and the other phase 3 trials, first of all. And then secondly, just as what was reported, how they do with the variants. But remember, the important thing is to have as many Americans vaccinated as possible. Having large amounts of people vaccinated across the country is what will decrease the reservoir for the variants to persist. And I'm not only worried about the 3 or 4 or 5 variants we know about today, I'm equally worried about the next 3 that we don't even know about yet. So we really need to get this under control as soon as possible in order to prevent the next round of variants, which could be worse.
Well, Doctor, talking about the variants and how you're worried about the ones that we don't even know about yet, employers have started to talk to their employees about bringing people back to work. When should that be done? Because I think there's a lot of confusion out there just as to how safe, if you're fully vaccinated, should you feel safe about going into the office?
It depends on the environment. If the workspace is such that people are able to maintain social distancing, if they're practicing good behaviors such as wearing masks and practicing good hygiene, and if most of the workers in that facility have been vaccinated, that's a safe environment. If the answer to those questions is no, or one or more of those questions, then you got to wonder whether it's safe enough. This is all about risk reduction and risk mitigation. We're never going to be able to eliminate the risk entirely, but we got to make the risk low enough so it makes sense for everybody. And that's going to vary case by case, depending on the answers to the questions I just raised.
Dr. Jay Schnitzer is Vice President, Chief Medical Officer, and Chief Technology Officer at MITRE Corp. Thank you very much for joining us.